Now here is the question. Do we really need insulin for every cell of the body? So for the glucose utilization by the body, when we talk about every organ and every cell, we don't need insulin. Insulin is required mainly for the transport of glucose in the heart, in the skeletal muscle, and in the adipocyte. I repeat again. Insulin is primarily required only for the transport of the glucose inside the adipocyte, inside the heart, and inside the skeletal muscles through GLUT4 transporter channel, GLUT4. Liver primarily does not need insulin for the influx of the glucose inside, but insulin is required for the metabolism or the utilization of the glucose inside the liver for whatever the process is happening, like gluconeogenesis or glycogenesis or glycolysis. For that, insulin is required. Clear? Brain does not need insulin for the utilization of the glucose. But it is said that some basic level of insulin is required for the brain to utilize the ketones. So as well as the glucose, some basal insulin is required, but otherwise primarily brain does not require insulin for its glucose transport. But insulin is a requirement for various biochemical pathways of the utilization of glucose. It's a different entity. So two things are different. One is transport of the glucose inside the cell, and second is utilization of the glucose. So utilization needs insulin, right? Transport does not in the brain. For ketones also, it is said that keto diet is given because we want to diminish the insulin. No, if the insulin is completely gone, brain will not be able to utilize ketones, therefore all those complications happen. A basal level or a minimum level of insulin, some level of insulin is required even to utilize the ketones. Okay, so it can't be zero insulin per se. Done?